When we talk about autism, we often focus on traits like sensory sensitivity, stimming behaviors, not being able to communicate or socialize with people in their environment. But here is something just as important. Most people living with autism don't just have autism. Research suggests that up to 70% of people living with autism have at least one co-occurring condition. So today, we are going to look at two of the most common co-occurring conditions, ADHD and OCD. So let's start with ADHD, autism plus ADHD, where ADHD stands for Attention Deficit Hyperactivity Disorder. Research suggests up to 50 to 60% of people living with autism to have ADHD. They share similarities like functioning challenges, how to regulate their sensory needs or to avoid them. But they interact in unique ways. For example, a child with autism would like to have a routine, time to bath, time to eat, time to do things. But someone living with ADHD does not like predictability. They just jump on things, they do everything, they are everywhere. So having ADHD and autism, sometimes there's a little confusion here and there. When both are recognized, support looks different. Visual timers, short tasks, and sometimes medication for the ADHD aspect. Now, let's talk about autism plus OCD, where OCD stands for Obsessive Compulsive Disorder. On the surface, they both share the same repetitive behaviors, but the whys are different. A person living with autism might line up toys in a particular way because it's a way of calming he or she down. It makes him or her feel good or maybe organized. But in OCD, when they decide not to use maybe a particular door, or they don't step on certain things, or they check their locks every now and then to be sure it's locked properly, it's out of a result of intrusive, distressing thoughts that if I open this door, something will come out and bite me, or if I step on this part of like my bed, I might fall into a deep hole. So one is autism is for calming the person down. The other is as a result of if I do it, something will happen, or if I don't do it, something will happen to me. Let me cite one example of how you can tell these two apart, because they both have repetitive behaviors. With autism, when a child is not able to when you avoid a child from doing the repetitive behaviors, there's some form of dysregulation. They are sad, they'll be crying, because whatever is supposed to calm them down, you are taking it away from them. But in OCD, when they avoid the compulsory behavior, they don't want to step here, and then you make them step there. It's like they are scared. It's like a form of fear. They are scared that something is going to happen. They are terrified. So these are the two differences. Someone will ask, so how do I teach my child, or how do I teach my student who has autism plus any of this co-occurring condition? Let's start with autism plus ADHD. 1, you have to break the task into smaller units. When you're teaching a child how to do something, break it apart. ADHD, the children are everywhere, but with autism, they like routine, so they know at this particular time I have to do this. But the ADHD aspects kind of prevents them from doing the activity. So you break it down. We are going to learn how to write a curve and a stroke. A curve and a stroke. You do that, you allow the child to go and do whatever he or she wants to do by bringing visual timers. So you break the task into smaller units, and then you introduce a visual timer. For 1 minute, we are going to learn how to write A. After 1 minute, the 20 seconds is for you to go and drum, to go and jump around, to go and play. That's you helping the child you are helping the child who has autism and ADHD to do activities and still get what they want to do by stimming and doing other repetitive behaviors. Now, for autism and OCD, One, use the exposure theory, where you expose the child to the things that he or she thinks is dangerous, or he or she thinks when he does it can endanger him or her. So I've once taught a child that when he hears the sound of a siren, he's all over the place, he's anxious, he thinks something bad is going to happen to him. So we expose the child we did an exposure theory for this child, where in our session room, we tell the child that I'm going to play the sound of a siren. Nothing is going to happen. I am here. If you want me to hold you, I'm here to hold you, and other things. So we play the siren very low. He can hear it. You see the child is anxious, but he can hear it. You are there. You are comforting him. Maybe the child has a weighted blanket to keep him calm. So you expose the child to this. We expose the child to this siren over and over, to the point that when the child hears the siren, he is able to tell himself that nothing is going to happen to me. Do you get? So as you expose the child to it, it helps the child to have control over whatever they think is dangerous to them. Respect sensory needs. Please, I need you to do that, because it's as important as any other thing to them. Because when they are anxious, they need to stim to regulate it. Other than that, they'll rather start throwing tantrums if you prevent them from stimming or prevent them from doing things that will help them regulate how they feel in the immediate environment. So don't confuse stimming behaviors for OCD rituals. OCD is an intrusive compulsive behavior. They have to do it. If they don't do it, something will happen. But stimming behavior, they do it, they rock for a while, you see that they are calm, they stop. So please respect the sensory needs. So that is it for today. I'll see you in another video. If you have any questions, if you need any further clarification, I'll be very glad to do so. So put it in the comment section. Follow me, share, like, and then I'll see you in another video. Bye.